At the Alternative to Med Center, we're redefining mental health to a world hungry for change.
My name is Lyle Murphy. I'm the founder of the Alternative to Med Center. Today what we're going to talk about is benzodiazepine withdrawal, which is one of the more difficult drugs for people to withdraw from. Withdrawal from a benzodiazepine is very similar to alcohol, except for most people the benzodiazepine can be even worse. It's one of the few drugs that a person could die from the withdrawal. And so most professionals know that in order to taper off of a benzodiazepine, it has to be done in a very slow and deliberate process. And for many people, especially people that are more or less addicted to the drug, that seems to be a very viable way of going about reducing and eliminating the Xanaxes and the Ativans and Valiums and benzodiazepines of that sort. But for other people, they have symptoms which some have called protracted withdrawal, have been called a variety of things. And for these people, the medication itself is, of course, a problem, and it's not fixing their underlying symptoms. And so they may feel that just withdrawing from the medication might be the remedy for their problem. And then they get a valiant effort going of tapering off the medication. And this is oftentimes where we receive them, where they've gotten to the point of pain and they can't figure out why their symptoms are so severe and their panic attacks are so severe that they can't get off the benzodiazepine. And this is where we pick up the ball. One of the means that we have used in order to help people taper off of medications is the use of orthomolecular medicine. And what that means is giving the person natural occurring substances in an optimum amount that allows for their neurochemistry to utilize these elements and build up their inhibitory neurotransmitters in the case of benzodiazepine withdrawal. However, we've noticed that regardless of how much GABA we give someone, which is an inhibitory neurotransmitter, or even how many serotonin precursors or IVs that we give a person, there seems to be something more exciting their system. And so we have found now that what is most common, and of all of the different modalities we have used, the one that has had the greatest effect is the isolation and the removal of toxins, specifically heavy metals, and of those heavy metals, specifically mercury. And the reasoning is this, that in order to synthesize neurochemistry, the neurochemistry that will destimulate a stimulus in our environment to not be as stimulating, like for instance when someone is coming off of alcohol, the bright light and the sounds, they've used up all of their inhibitory neurotransmitters the night before. And so therefore they don't have the ability to destimulate events in their environment. And with a person that's been on benzodiazepines, they've only been using the medications to destimulate. So when they are off of those medications, their ability to destimulate is severely impaired. So those neurochemicals that form those inhibitory neurotransmitters are synthesized from natural occurring substances. In the case of serotonin, tryptophan is a direct precursor to make serotonin. And to make serotonin, there's other cofactors that are necessary, other vitamins and minerals. So theoretically, if a person has all of those cofactors, they should be able to synthesize a normal or near normal amount of serotonin depending on their genetics. And we have found that there is another large piece to that, in that there are inhibitors. These inhibitors, namely toxins, affect the rate-limited steps for the neurochemistry to be generated. So a person's ability to convert, let's say, serotonin into melatonin would be impaired by mercury. And so then you'd have someone that can't sleep, someone that has insomnia, and when trying to come off of a benzodiazepine, the inability to sleep could greatly and does greatly affect their ability to be able to taper off these medications. And oftentimes, that's why they were prescribed the medication in the first place, was to help them sleep. So until that underlying symptom and those underlying toxins are removed, the neurochemistry is not going to regulate with only the use of vitamins and GABA and things like that alone. Those factors are meant to work in a toxin-free environment, or at least one that's been largely reduced of toxins affecting the way that neurochemistry is synthesized. Also, a person that has been on benzodiazepines and is suffering from anxiety, in doing brain chemistry tests, it's observable that they have a high norepinephrine. Norepinephrine is synthesized from dopamine, and it is an excitatory neurotransmitter. It is largely regarded as a chemical marker for anxiety. Norepinephrine converts into epinephrine. Epinephrine is the chemical that it's adrenaline. It's when someone has been stung by a bee, they give them an adrenaline shot. And for about 15 to 30 minutes, they're very, very excited. But that epinephrine breaks down relatively fast, where the norepinephrine does not. High norepinephrine can cause a person to be stimulated for a very long time. And so this conversion of norepinephrine to epinephrine is also impaired by toxins, specifically mercury. So we see a person that's on benzodiazepines being very high in norepinephrine because they're not able to convert. By far, the most successful action we have taken to help rectify someone's symptoms of anxiety has been heavy metal toxin removal. The method that we use to clear out toxins from someone's system so that their neurochemistry can self-regulate is called a chelative sauna. We give oral chelators to a person, and then we allow them to sit in a sauna for up to 2 hours. Through this process, and during the 2 hours, they're given nutrients, a lot of water, and a regimen of exercise so that they can push toxins out of their system. And the sweating allows for those toxins to come out through the skin, thereby unburdening to a large degree the liver and the kidneys. Another way in which toxins affect our neurology, organic toxins such as pesticides, is through overstimulation. How many pesticides work and how they kill an insect is by disabling the insect's ability to regulate acetylcholine. Acetylcholine is an excitatory neurotransmitter. And what the pesticide does is it allows the acetylcholine channels to be stuck in the open position. So the insect gets a constant influx of acetylcholine. This overstimulates the pest's neurology. The pest goes into catatonia and then dies. And this is the same effect that the pesticides have on us. They accumulate in our system and they overexcite our neurology. They act as excitotoxins. And this is very similar to the type of effects that we see in people that are having panic attacks and need benzodiazepines. Their neurology is in a constant state of overstimulation. There's another series about the chelative sauna, which I would encourage you to view. Thank you for your time.
At the Alternative to Med Center, we're redefining mental health to a world hungry for change.